I'm going to pass the baton pretty quickly here, just introducing Rachel Fox, and she'll be joined shortly by Linda Howe. They're going to give a short presentation on the Wolk Center and their new program, which focuses on brain health and wellness coaching, which I'm curious to learn more about myself. There will be some time for questions afterwards. They have just a handful of slides, so stick around. Rachel, passing it on to you.
All right, thank you so much, Tara. Let me pull up this PowerPoint.
You're all set. Good.
There we go. All right, thank you so much. Glad you guys can see that. Thank you for having me here today. I'm very excited to share with you all a bit more about the Deanna and Sydney Wolk Center for Memory Health here at Hebrew Senior Life. Some of you might know us, some of you may not, so I just like to share a bit about what we are and everything that's available to you if you'd like to take advantage of it. So first off, the Wolk Center for Memory Health is a part of Hebrew Senior Life. We're an outpatient specialty clinic focused on brain health. And we have a very interdisciplinary team of clinicians. You can see them all there in that flower petal, blue flower petal. And we aim to be a one-stop shop for all of your cognitive and memory concerns, both for patients and for their families as well. We're here for patients and families at absolutely every stage, whether you already have a diagnosis from a doctor, you or your family are concerned about changes in your cognition, or you just want to check up and see how your brain health is doing. We cover it all. One thing I do want to mention is the importance of getting a checkup on your brain health early or engaging in preventative measures. It's been shown that the brain pathology, or the changes in your brain that cause Alzheimer's disease, start 20 years before symptoms start, which means probably most, if not all, of the people in this Zoom right now have some of those changes in your brains at this exact moment. However, it takes time to actually see or notice these changes. Some of you might have a couple memory concerns now, some of you might in a few years, and some of you will never see changes. That's of course what we hope for. Despite that, it's never too early or too late to get a checkup on your brain health. Just like you go to the doctor for your physical every year, or you get a checkup on your heart, your brain's a vital organ that most people don't get checked out until they have symptoms. And while we still do whatever we can to help and treat patients that are having these symptoms, wouldn't it be better if you did something to prevent ever having those symptoms in the first place? Though we can't turn back the clock on the pathology in your brain, research has shown making changes and improvements to your lifestyle can prevent or delay getting dementia by over 45%. That's almost half. For people that have already seen changes in their cognition, having a good lifestyle for your brain health can delay the decline and progression by about 40%, which is also pretty high. We've recently opened a program focused on prevention that assists you in making these beneficial lifestyle changes, which is our lifestyle coaching that I myself am running. I'll get more into that in a little bit, but first I want to tell you, in addition to preventative measures, we also have a team led by our cognitive neurologist and medical director, Dr. Alvaro Pasqualeone. I'm sure many of you recognize that name, that focuses on getting you the right diagnosis, if you need one. If you go to your primary care provider with memory concerns, they may just give you a broad diagnosis of dementia. Here at the Wolk Center, though, we individualize the diagnosis process through biomarker testing and more, so that we can find your exact diagnosis and get you the right treatment. Knowing the right diagnosis not only means that you get that right treatment to best help, but it also means we know more about how it will progress over the coming years. With our person-centered diagnosis, you can be empowered with your diagnosis instead of getting a one-fits-all blanket diagnosis that doesn't either help you or help your future. Our team consists not only of the incredible Dr. Pasqualeone, who's considered one of the top 10 best neurologists in the world, but also of an amazing nurse practitioner, geriatrician, and neuropsychologist, who all aim to bring you a step closer to that correct diagnosis. But our help and our aid does not end after a diagnosis. We have several treatments available that you can pursue to help your memory and cognition, such as being prescribed medication, trying a new drug trial, or brain stimulation. Some of you might know the Marcus Institute and the amazing research work that they do. They have studies that use non-invasive brain stimulation to help people with their memory and mobility for getting around. Unfortunately, if you've taken part in a research study, you'll know that once your participation is over, you can't get that intervention anymore, even if you benefited from the treatment. Or maybe you tried to participate in a research study and you were ineligible for it. Dr. Pasqualeone, however, is an expert in the field of brain and brain stimulation, and he himself runs some of those studies, but he's brought those ideas and that treatment to the Wolk Center. And their patients can continue after a research study, they can get in with us and have that similar treatment that helped them. Or if you were interested in it and you couldn't participate in a study, you can get it here instead. Our brain stimulation here is focused on improving your cognitive reserve, which has shown to help prevent or delay disease progression and prevent from it getting to a point of dementia. We also have TMS, which is focused on improving depression or anxiety that is medication resistant for patients. So medications don't work, there is still another option. One theme all of our clinicians echo is to focus on what matters the most to you. Our palliative care specialist, Dr. Cora, most especially so. She empowers patients to share what matters the most to them and how they want to live their life over the next several years. And they can share those dreams and those hopes with their families while they still can. She also has family meetings with their caregivers and families where they have the chance to express their concerns. We have a psychiatrist who helps patients with depression, anxiety, and managing their medications. And we also have an incredible social worker who helps get resources for patients, families, and caregivers, refers them to help get them into the programs and the support that they need. She also runs a very popular caregiver support group that a lot of people take advantage of. Finally, there's one more offering that we're planning to start up in a couple of months, but I'll let you know about it now. So with the combined efforts of our neuropsychologist and wellness coach, myself, we're opening up a group focused on cognitive rehabilitation. This is for people to follow a cognitive prescription given by the neuropsychologist and work together to help improve their memory, cognition, problem solving, and more than that. So even if they're seeing difficulties and having trouble with things, there are ways that you can turn that around, especially with us here to help show you that way and empower you through it. So now I'd love to share with you a little bit more about our lifestyle coaching in particular. So quick question I'd like all of you to ask yourselves. Are you currently living your best life? Are you happy with absolutely everything in your life? Are you at your optimal health and well-being? If you're not, I'm sure you have a few things you want to prioritize for your health and well-being over the next few months or the upcoming year, especially with New Year's resolutions. I am a certified health and well-being coach, and I have a background in brain health, especially here at the Wolk Center. And my role as a wellness coach is to help you prioritize what matters most to you along your journey to finding optimal health and well-being. I really want to get you back to living your best life, whatever that means for you right now. This is done through changes to your lifestyle. I'm sure you all know having the right diet, being physically active, and a good overall lifestyle is beneficial for your body or your heart. But did you know it's also beneficial for your brain, which is arguably one of the most important parts of our body? As I mentioned earlier, over 45% of dementia cases can either be delayed or outright prevented just by leading a healthy lifestyle. You might think it's all based on genetics, or maybe any change that you make now isn't going to have an impact. But science shows that that's not how it works. When a lifestyle change is made with someone who's even having trouble now, 40% of those people do not progress towards a dementia when they otherwise would have, and they can live their best lives for longer. So this is how my coaching sessions work in a nutshell. First, I'll ask you some questions about your lifestyle and physical health during a brain health assessment. This shows how different factors such as your education, physical health, diet, mental health, and others impact your brain. After that, we'll meet 8 times for your coaching sessions. Those are usually about once a week, once every 2 weeks. We will discuss what matters most to you and your priorities for your health and well-being, in addition to planning out small steps each week that will lead you in that right direction on your path. These coaching sessions are completely individualized to you and are collaborative in nature. I want to work with you to find a solution for you instead of telling you some generic formula for wellness. You can get that off the internet. So before I wrap this up, I'd like to tell you a quick story of a patient of mine whose life has recently changed through coaching. When he was younger, he played the violin. He actually played the violin on stage with Aretha Franklin and performed with her. Now, however, he has a diagnosis of mild cognitive impairment, and he has a lot of arthritis in his shoulder, in his hands, and he can't play that violin anymore. And he has an intense love for playing music and the joy it brings him, and his current life without having playing music in it was just dreary. And that only made his diagnosis and his brain health outlook dreary as well. And it would look worse over time. Together in our coaching sessions, he found that while the violin may not be possible for him anymore, he can play other instruments and continue his love of playing music through playing the guitar and the mandolin. And now he's playing in a musical group. When I last saw him, he was way more optimistic about not just his life in general, but about everything, about his outlook. And he was ready to take on just about anything. A more personal example is my own mom. My mother was able to change her cholesterol levels, which I'm sure some of you can relate to, from being extremely high to the point of needing a medication to bring it down. She didn't want to have to do that, and so she was able to change up her lifestyle just a little bit, and over a few months, she brought it down low enough so that it's in the normal range, and she doesn't need that medication anymore. And that also benefits her brain health too. So while everyone has a different focus on what matters the most to them and lifestyle changes that they want to prioritize, it's usually very difficult to do it on your own without support or a clear path out in front of you. I aim to work with you in not just the creation of goals and why they're important to you, but also help light up and reveal that path in front of you to bring you closer to your best life. So this is just one of the many offerings at the Wolk Center for Memory Health. But if you are at all interested in what we offer or in the wellness coaching, I do highly encourage you to reach out. I believe we'll be sending out some flyers that has some contact information after this meeting. So you can reach out by phone or by email, or I can write your name down now and give you a call if that's what you prefer. So please, any questions? I see, Charles, you just raised your hand.
Go ahead, Charlie. I'll manage that. please.
So do you have to be referred to the Wolk Center for issues, Or how, is it just a walk-in kind of concept? That's number one. And number two is it covered by insurance and how does that work?
Yeah, absolutely. I can tell you a little bit more. So the Wolk Center is an outpatient, so it's just like any other specialty doctor's clinic. So you would, if you want their regular services, need to be referred by typically your primary care provider. You don't need to go to your primary care for memory concerns and then go over. A lot of times they'll give you a referral just because you're concerned. But everything at the Wolk Center, with the exception of a few treatments, are covered by insurance. So neurologist visit, geriatrician visit, all of that is covered by insurance. Unfortunately, the wellness coaching that I've just mentioned, that is private pay. Insurance does not cover coaching right now, as beneficial as it is. And so that would be something that we would discuss for private pay.
Thank you.
Hey, Barbara, did you have a question?
It was answered. I
Okay.
answered it.
Any other questions? Okay, then everybody will look forward to receiving your contact information in case they want to